It's really good to hear everybody at the table say that there's no one size fits all in terms of responding to this. We know it's a complex issue, requires a comprehensive response. And I'm going to go back to the safer supply claims that have been made, because we saw BC with an overdose rate go up 5%. That's not good. Ontario, 6.8%. Two provinces that have safer supply programs. But we saw in Alberta, death rates went up 23%. Saskatchewan had gone down but jumped 32% last year. 30 U.S. states, from the numbers we have, 2019 to 21 doubled. Baltimore is 4 times the death rate of Vancouver. Philadelphia is double. Washington, Milwaukee, more, all without safe supply. So, Dr. Sereda, when you hear people point to safe supply as the cause for this crisis and driving death rates, and then you hear about the numbers in places that have no safe supply, maybe if you could speak to how this isn't factual and anecdotal comments are causing harm to communities, and take you've got a minute and 20 seconds, and you can add whatever you'd like to.
Yeah, it sets my brain on fire a bit, to be completely honest, because it is simply not possible for safe supply to be driving these deaths. It's not possible with the number of people receiving it compared to the number of people who use drugs and the number of people who are dying. And you're absolutely correct. In Canadian provinces that have robust harm reduction programming, not just safe supply, but robust harm reduction, we have seen less death in these provinces than in provinces that embrace an entirety of the entire spectrum of treatment approaches, like I mentioned in my opening remarks. And so when I see these other cities, my heart absolutely breaks, because that means there are 4 times as many families who don't have their loved ones anymore. It means there's 4 and 5 and 8 times as many, kids without their parents or parents without their kids. And I think we need, thank you.
What do you believe needs to happen? 1.8% of those that use substances on a daily basis in British Columbia, 225,000 are getting access to safer supply. What's the response that's necessary in this health crisis?
And so just to be clear, 225,000 are not receiving safe supply. 4,500 of 225,000 are receiving it. To get ahead of this crisis, I say the horse is just not out of the barn. It's all the way down the country laneway, and we're just chasing it and trying to get it back. We need...
I'm sorry, Dr. Sereda.